Beyond the trip, beyond the haze, we're lighting up these shadow waves. Ketamine dreams to...
Welcome back to Conscious Healing, Beyond the Trip, hosted by Dr. Jason Harris. Each week, Dr. Harris explores the world of ketamine and other psychedelics, uncovering how they're helping to treat mental health conditions and chronic pain disorders.
This podcast is intended for educational purposes only. The information shared should not be considered medical advice. Always consult with your physician or a qualified healthcare professional before making any changes to your medication or treatment plan. Please be aware that some of the substances and treatments discussed on this podcast may be illegal in certain jurisdictions. We do not endorse or encourage the use of illicit substances. Welcome to Conscious Healing Beyond the Trip. I'm Dr. Jason Harris, an emergency medicine physician with a passion for exploring the therapeutic potentials of ketamine and other psychedelics. In this podcast, we dive deep into the medical, psychological, and transformative aspects of these treatments. Whether you're a seasoned practitioner or simply curious about alternative healing methods, join me as we uncover insights and stories that go beyond the ordinary. Today, we're diving into a topic that touches the lives of thousands of Texans, the Texas Compassionate Use Program, or Teacup, and the significant changes set to take effect in just a few days on September 1st, 2025. This isn't just a tweak, it's a major expansion that could reshape access to low THC cannabis for many patients. For years, Teacup has been a lifeline for a limited number of Texans. It began in 2015, a small step initially, only for patients with intractable epilepsy. Since then, it's seen gradual expansions, but often felt restrictive to many who believed they could benefit from medical cannabis. But as of September 1st, 2025, a new chapter begins, offering hope to a much broader patient population. Let's quickly recap where Teacup has been. When it was first signed into law by Governor Greg Abbott in 2015, it was incredibly narrow. Think baby steps in the grand scheme of medical cannabis programs across the nation. Over the years, lawmakers and the governor slowly expanded the program. In 2019, the list of qualifying conditions grew to include all types of epilepsy, not just intractable. Then, in 2021, we saw the addition of cancer and PTSD, and the THC cap was raised from 0.5% to 1% by weight. These were important, incremental changes, but many still felt the program was too limited, too difficult to access. Until recently, Texas was an outlier with one of the most restrictive medical cannabis programs in the country. This meant that while patients in other states had access to broader conditions and more product options, Texans were left seeking alternatives, sometimes in unregulated markets or simply going without. Imagine for a moment, it's July 1984. A young Greg Abbott, then a 26-year-old law student graduate, is out for a jog in Houston. Suddenly, a massive oak tree snaps, falling on him and crushing his spine, leaving him paralyzed from the waist down. The pain in those initial days, weeks, and months would have been incomprehensible, a constant searing agony as his body reeled from the trauma. Beyond the immediate physical pain, there would be the chronic nerve pain, muscle spasms, and the sheer discomfort that often accompanies such a life-altering injury. In that era, his pain management options would have been far more limited. Strong opioids would likely have been the primary recourse, bringing with them a host of potential side effects, from nausea and constipation to the risk of dependency. Physical therapy would have been crucial, but even that would have been punctuated by bouts of severe pain, making consistent progress difficult. Sleep would have been elusive, constantly interrupted by discomfort and involuntary spasms that can plague those with spinal cord injuries. Now, let's fast forward to today, or rather September 1st, 2025, with the expanded Teacup. If that tragic accident happened now, Governor Abbott's journey could look remarkably different. With chronic pain and spasticity as qualifying conditions, he would immediately be eligible for low TH cannabis under the program. Think of the relief. Instead of relying solely on opioids, a physician registered with Teacup could prescribe him a low THC cannabis product, perhaps a transdermal patch for consistent, long-lasting pain relief throughout the day, allowing him to focus on rehabilitation exercises without the constant distraction of throbbing pain. For sudden severe spasms, an approved inhalation device could offer rapid relief, calming his muscles and enabling a fuller night's sleep. He could use a topical lotion to soothe localized discomfort or a suppository for more systemic and prolonged effects. Immediate pain and spasm relief. Consider the holistic benefits. Better sleep would contribute significantly to his overall recovery and mental well-being. A reduction in reliance on heavy-duty opioids could mean fewer side effects, allowing him to maintain greater mental clarity and energy as he navigated his new reality. Access to regulated, tested products would provide peace of mind, ensuring consistency and safety. Even in the decades since, as Governor Abbott built his career and life, Teacup could have continued to offer support. The chronic pain from a spinal cord injury doesn't just disappear. Regular access to low THC cannabis could have provided ongoing symptomatic relief, enhancing his quality of life and potentially allowing him to manage his condition more effectively and with fewer systemic side effects than traditional pharmaceutical approaches. It's a hypothetical, of course, but it illustrates powerfully how this expanded program could bring tangible, life-changing benefits to Texans suffering from debilitating conditions, offering a compassionate alternative for managing profound pain and discomfort. Now, let's fast forward to the exciting news. House Bill 46, signed into law by Governor Abbott this past June, is the game changer. This bill represents the largest expansion of Teacup since its inception, and it's bringing some truly impactful changes starting September 1st, 2025. The most significant update is the expansion of qualifying conditions. This is huge. Previously, conditions like chronic pain were notably absent, forcing many patients to rely on opioids or other less suitable treatments. But, come September 1st, the list will include chronic pain. This is a major addition, as it opens the door for thousands of Texans suffering from continuous or intermittent severe pain lasting more than 90 days. Importantly, the new law left out the previously recommended requirement that chronic pain patients had to first try and fail opioid treatments. This is a crucial shift towards safer, non-opioid pain management alternatives. Next, Crohn's disease and irritable bowel disease, bringing relief to those dealing with these challenging digestive conditions. Traumatic brain injury, acknowledging the complex needs of TBI patients. Terminal illnesses and patients admitted to hospice care, offering compassionate care for those in their final stages of life. These additions join the existing list of conditions which include amyotrophic lateral sclerosis, ALS, or Lou Gehrig's disease, autism spectrum disorder, all stages of cancer, epilepsy and seizures, incurable neurodegenerative diseases like Alzheimer's, Huntington's, and advanced Parkinson's, multiple sclerosis, PTSD, and spasticity. This truly makes Teacup a much more comprehensive medical cannabis program, finally meeting criteria many organizations use to define such a program. But the changes don't stop there. Another significant update is the expansion of the allowed modes of delivery. For a long time, patients were limited to oral tinctures, edibles, topical balms, and liquid product. These often meant slower onset of effects, which isn't ideal for acute pain or immediate symptom relief. As of September 1st, Teacup will also permit lotions, transdermal patches, suppositories, approved inhalation devices including nebulizers, vaporizers, and inhalers when approved by the prescribing doctor. Unfortunately, these devices won't be available on September 1st, 2025. The head of Texas Department of State Health Services has until October 1st, 2025 to approve these devices and provide direction to dispensaries on how to dose the medication from these devices. So it will take some time before these are available at the dispensaries. This is a big deal for patients needing faster acting relief, especially for conditions like severe muscle spasms or breakthrough pain. It allows for more precise dosing and immediate impact. It doesn't stop there. There's more good news on accessibility. The number of licensed dispensing organizations is expanding from a mere 3 to a total of 12. 6 of these dispensary licenses will be issued by December 1st, 2025, and the final 3 will be issued by April 1st, 2026. They will also allow for satellite locations. This is crucial for improving access for patients across our vast state, reducing travel burdens and wait time for prescriptions. These dispensaries will be allowed to store medications at these locations, which is different than how it is now, where they have to bring the medications to a pickup location every day. So they're driving from Austin to Dallas and San Antonio and all the way down to Brownsville. Texas is a massive state, so it costs a lot of money, which increases the cost of the medication. Finally, the previous 1% THC limit by weight is being replaced with a 1 gram of THC per package limit, with a maximum of 10 milligrams per serving. This shift provides more flexibility for patients and dispensing organizations to formulate products that meet specific needs without being constrained by percentage-based limit that could be misleading depending on the product type. So what does all this mean for patients and doctors in Texas? For patients, these changes are a breath of fresh air. It means more people will qualify for the program that provides regulated, tested, and doctor-supervised low-THC cannabis products. For those with chronic pain, it offers a non-opioid alternative that could significantly improve their quality of life. The expanded delivery methods mean more tailored and effective treatment options. And finally, with more dispensaries, the accessibility barrier should be significantly lowered and the prices should come down. It's important to remember that while the program is expanding, it's still not a recreational program. Patients must be permanent residents of Texas, have a qualifying condition, and receive a prescription from a physician registered with the Compassionate Use Program, which I am. There's no separate state application fee or wait time once approved by the doctor. Your prescribing physician will enter your information into the Compassionate Use Registry of Texas, or CURT system. For doctors, these updates present both opportunities and responsibilities. Physicians licensed to prescribe low THC cannabis must be board certified in a medical specialty relevant to the patient's condition and be registered with the program. The expansion of qualifying conditions means more conversations with patients about low THC cannabis as a viable treatment option. It also underscores the importance of ongoing education for medical professionals on cannabis as medicine. Dr. Keogh, Chief Medical Officer of Texas Original, a dispensing organization, has noted that previous expansions captured many patients who were using unregulated CBD products. These new changes will likely bring even more patients into a supervised, regulated framework, ensuring better product quality and integration into their overall medical care plan. It's also worth discussing the ongoing legislative discussion surrounding hemp-derived THC products in Texas. While Teacup is expanding, there have been efforts like Senate Bill 5 to ban most hemp-derived cannabinoids outside of the medical program. Governor Abbott recently vetoed a similar bill, Senate Bill 3, instead calling for a special session to regulate these products more effectively. This highlights the complex and evolving landscape of cannabis policy in Texas, where the focus remains on ensuring access for medical patients while addressing concerns about unregulated process. The expansion of Teacup may be seen by some as a way to provide a legitimate, regulated alternative for those who were previously relying on the gray market. These changes coming September 1st mark a significant step forward for Texas in the realm of medical cannabis, while it still maintains a low THC designation. The expanding qualifying conditions, product forms, and increased accessibility make it a far more robust program than ever before. What does the future hold? It's hard to say definitively. Texas remains a conservative state, and full adult use legalization isn't on the immediate horizon. However, consistent expansion of Teacup shows a growing recognition of therapeutic potential of cannabis. As more patients experience relief and more data becomes available, the conversation around cannabis policy in Texas will undoubtedly continue to evolve. For the patients, the message is clear. If you or a loved one are suffering from a qualifying condition, especially chronic pain, traumatic brain injury, Crohn's disease, or a terminal illness, and believe low THC cannabis could help, September 1st is a date to mark on your calendar. Speak with your physician and explore the possibilities within the updated Teacup. For medical professionals, it's an opportunity to embrace new treatment modalities and to ensure their patients have access to all available options for an improved health and well-being. This is a pivotal moment for medical cannabis in Texas. It's about compassion, access, and putting patient needs first within a regulated and medically supervised framework. Stay tuned next week for our next episode where I will discuss the importance of set and setting in the world of psychedelic medicine. This podcast is not medical advice. It's a conversation, one that's evolving. So talk to your doctor, ask hard questions, but remember, your provider might not be up to date on the latest research or might be closed-minded to the use of psychedelics or medical marijuana, even though the science is there. Stay skeptical, but stay open-minded because sometimes the most important healing paths are the ones nearly forgotten. If you found this program interesting and you want to continue to learn more about psychedelics, alternative, and non-traditional treatments, then please click subscribe below and click the bell icon to be notified about newly released shows. Also, please visit us on Facebook, Instagram, and TikTok, Conscious Healing MD, for more about our show. Thanks for joining me on Conscious Healing Beyond the Trip. I'm Dr. Jason Harris. Until next time, stay curious and stay informed.